Hi everyone, I am Mesam Ali, a master's student at India University. Today I am standing before you to present the topic subject to machine learning based techniques for the prediction of axillary lymph node metastasis in early breast cancer. The prediction of axillary lymph node metastasis in early breast cancer is a critical aspect of breast cancer management. Axillary lymph nodes are a common sites for the separate of the breast cancer cells, and determining whether these nodes are involved helps guide treatment decisions and prognosis. And moving forward to the next slide, here is the tables of contents. We have a comprehensive overview of the contents that we will cover in today's presentation. We will begin with an introduction to set the content, followed by a clear outline of the studies objective. We will explore the challenges associated with sentinel lymph node biopsy, and then walk through the entire workflow of our research study. Additionally, we will discuss related works in the field and dive into the materials and method employed and provide detailed description of the features within our dataset. The implementation of machine learning models will be explained, leading us to the results and discussion section. Finally, we will wrap up with the conclusion and touch up the potential future work. We acknowledge breast cancer as in introduction. We acknowledge breast cancer as a heterogeneous disease with diverse prognosis. We highlight global advancements in research and public health initiatives that have significantly increased breast cancer survival rates, emphasizing emphasizing the importance of accurate preoperative assessment. We recognize the role of axillary lymph node metastasis is a significant prognostic factor in breast cancer. We discuss the limitations of the non-invasive imaging methods such as ultrasonography, CT scan, uh, and the MRI and the PET and CT, which are found to be insufficiently sensitive for identifying ALN, axillary lymph node metastasis. This sets the stage of our study, where we aim to address the challenges using machine learning techniques. Our objectives is to develop a comprehensive understanding of the factor influencing accurate axillary lymph node assessment in breast cancer patient. We aim to enhance the predictive accuracy of axillary lymph node metastasis status by employing advanced technologies with a specific focus on reducing false negative rates associated with the current diagnostic approaches. To achieve this, we leveraging state-of-the-art machine learning algorithms to analyze complex datasets, allowing for a more nuanced evaluation of the breast cancer progressions. The study aims to provide clinicians with a robust decision support tool. The limited sensitivity of the particular in specific breast regions, that is the challenges with sentinel lymph node biopsy, as we are discussing that limited sensitivity particularly in specific breast region associated with a notable false negative. These are the challenges. False negatives are may cause patient anxiety and complicate treatment decisions. Potential for inclusive results introducing uncertainty in axillary lymph node status determination. A risk of understaging a sentinel lymph node biopsy may miss metastasis or isolated tumor cells. As we go further, in this slide, the workflow of our research study is outlined. Axillary lymph node metastasis dataset. Commencing with axillary lymph node datasets are our foundation. Feature extraction. Conducting feature extraction from the dataset to identify key variables. Training and testing split. Divided the dataset into training for 80% for training and the 20% of the data for testing. Set for model development and evaluation. Machine learning models that we have employed, applying advanced machine learning models such as gradient boosting, KNNeighbor, and the decision tree. Performance measure as we calculate it, evaluating model performance through various matrices, ROC curves like assessing the trade-off between the sensitivity and the specificity, accuracy, measuring all over correctness, precision, calculating the accuracy of positive predictions, identifying the proportion of the true positives, and the last we are assessing the F1 score, balancing precisions and recall. Final classification concluding with final classifications of the metastasis, either it metastasis or non-metastasis. It will differentiate and classify based on the model's predictions. As we further move, we will in this slide we will outline the methodology employed in the related works, like in the form of related works. Specifically focusing on patient criteria, that F18, FDG, administration, imaging protocol, image analysis, SUV max calculation, and performance metrics. Patients including involve maintaining blood glucose levels below 8.3 ml with a minimum fasting period. The imaging protocol include a low dose CT scan for attenuation correction and subsequent 3D PET scans. Image analysis retrospectively reviewed F18 FDG PET CT scan image visually compressed with the breast MRI images to identify genuine IDC lesions. By moving forward, we will discuss the materials and methods. In materials and methods section, we utilize a dataset from DECON encompassing information from 549 patients and consisting of 28 features. Data preparation involved addressing the categorical and non-categorical values, null values, and outliers, ensuring dataset cleanliness by eliminating the outliers and null values. We applied one hot encoding and label encoding for the categorical and non-categorical values respectively, and converted raw data into the stable format for machine learning models. 3 feature selection we employed to identify 21 pertinent attributes, and we implemented 3 state-of-the-art machine learning models using the refined dataset that we have pre-processed before. This meticulous approach in data preparation lays the foundation for accurate model training and evaluation. In this slide, we will discuss the feature descriptions of the data. We present a comprehensive overview of the features in our dataset, organized into 2 columns, feature and feature type. The feature range from age marked as continuous to HER SSH ratio categorized as categorical. In between, we have features such as diagnostic name and the cancer location marked as categorical, while cancer size, NG, and H are identified as the continuous values. These slides detail the implementation of the 3 machine learning models. Decision tree, crucial for predicting lymph node metastasis based on input features. Develops rules using factors like tumor size, location, age. Classifies patient into groups with or without lymph node metastasis. KNNeighbor KNN predicts metastasis by identifying K nearest patient with similar variable. Non-pragmatic and logic based, rely on dominant class among neighbors. critical choice of K value and distance metric for reliable prediction, gradient boosting iteratively trains decision trees, compensating for prediction errors, fit trees to residual in repeat cycles capturing complex patterns. Enhance the model through an iterative process for a reliable assessment of the lymph node metastasis likelihood. In this slide, the result and discussion section we will discuss. We included 549 patients recorded for analysis after eliminating missing values during pre-processing. The investigation focused on 21 relevant features from the pre-processed data, employing 80% for the data training and 20% of the data for the testing. We used three models: gradient boosting, KNNeighbor, and decision tree. The evaluation involved calculating accuracy, specificity, and the recall metrics for each model, providing a comprehensive analysis of their performance in predicting axillary lymph node metastasis. In this slide, we drew the ROC curve of all the three implied machine learning model and compare its accuracy on the data to observe how well the implied model is working and learning the patterns within the data. As you can see in the result of all three models achieved a satisfied outcome, and the GBM performed well among them all. In the conclusion, our study successfully employed three machine learning models to classify the predict axillary lymph node metastasis. These models provided precise and interpretable prediction, offering valuable assistance to doctors in tailoring treatment plans based on individual prognosis. By considering diverse patient factors, our models contribute to a comprehensive understanding of the axillary lymph node involvement, facilitating the personalized treatment strategies aligned with specific patient needs. This method presents a significant advancement in patient care, leveraging machine learning for tailored prognostic assessment. If we discuss about the future work and future direction, for future work we aim to integrate diverse data sources including genomic, clinical and imaging data, MRI as CT scan, to potentially enhance model accuracy through multimodal analysis. Additionally, our focus will be on creating models that provide interpretations of justification for their predictions, crucial for understanding the clinical decision making. Collaborating with the clinicians for model validation across varied patient populations and real world clinical settings is essential to assess generalizability. Encouraging data sharing among researchers and institutions to build larger, more diverse data sets is also part of our future endeavors, aiming to improve model robustness and applicability.